Hi, welcome to the research portion of our show. And with us again, Ralph Turchiano with his knowledge.
Well, thank you very much for that intro. Well, if I had to ask you a multiple choice question, a simple question, if you were to have surgery at a hospital, would the hospital, now I don't want to lead the question, would the hospital make more money if the surgery went right, or would they make more money if the surgery went wrong? Now, common sense dictates, well, obviously, if you do the job right the first time, that you save money and time. Well, unfortunately, in a modern economy, that is wrong. In an article listed, U.S. hospitals make more money when surgery goes wrong, and this was published in the Journal of American Medical Association just last week, and this being, I think, April 22nd. They said U.S. hospitals face distinctive it's not distinctive, I apologize, disincentive to improve care because they make drastically more money when surgery goes wrong. Wait till you find out how much more money they actually do. They said, privately insured patients, which probably most of us that are watching the show, with complications provide hospitals with 330% higher profit margins than those whose surgeries went smoothly. The study was obviously published in the AMA journal. 190% higher profit margin when complications arose following surgery through Medicare patients. So if you're retired, guess what? You make that qualifier as being a possible money bag for the hospital. So let's put it this way. It is noted that hospitals are not rewarded for quality of care. In fact, they're rewarded for the lack of quality. Meaning, what they're attempting to do is harvesting money from you, basically one way or another, doing harm to create profit. I know that's kind of tough to believe, but the numbers pan out. They said they want to find out exactly how much more money they make when harm is done. Now, what they did, this wasn't just done on 1 or 2 patients. This was studied on 34,256 patients from 2010 at the 12 hospital systems in the United States, and they looked at 1,820 procedures. Now, let's put it this way, a little scenario. Here you are, you're a doctor which gets some profit from a hospital. Now, I don't want to imply anything wrong. Not going to do that because that would be prejudice. But let's say here you are a surgeon. You have stock in the hospital you're working at. You have your patient on the table. You have to think to yourself, well, you know, I need to pay for that Mercedes-Benz or Jaguar. But at the same time, too, I kind of care about this patient. What you have to think about is this, and this is the dilemma. If that surgery goes right, and you do everything perfect, your profit margin is going to be very respectful. It's going to be $16,936 on the average surgery. But if something should go wrong, poorly cut vein, I leave my glove inside the patient, forget to stitch something, a little bit of C. diff, bacteria, a little bit of jaundice infection, if something should go wrong, I will make $55,953 versus $16,936 in this privately insured patient. Now, is this a moral dilemma or a financial dilemma? Well, think about that. You're going to think, well, the patient's insured anyways, and the insurance company's going to pay for it one way or the other. And so, no harm, no foul. It's kind of like the way a person would think when they go to steal from a department store. Well, the insurance from the department store is going to pay them back anyways, so just money goes around, a different way of greasing the wheels of the economy. And the profit margin is actually higher upon Medicare patients. They don't make as much, but the percentage-wise. So instead of making 330% off of basically privately insured, if you look at basically the lower figures, Medicare, there's $1,880 if the surgery goes right, and it's $3,687 if the surgery goes wrong. Now, it's kind of weird when you think about it, why the differentiation in the cost of surgery is so weird between different types of payment systems. Now, if you want to go in the hospital and make sure they're not going to screw up, guess what? If you pay out of pocket, no profit, and basically it's making something go wrong with you. Interesting. Something to think about. If your life depends on it, you want to spend very little time in the hospital, pay out of pocket. And that seems to give you a huge advantage of everyone else that's sitting around in the hospital watching TV with nothing else to do because they can't figure out why the doctor left a glove inside the person's stomach. All right, they said, quote, most hospitals will see their financial performance hurt if there are reduced complications. Is that a suggestion or an observation? All right, after that, omega-3 fatty acids more effective at inhibiting growth of triple-negative breast cancer. Now, guess what? There is no effective chemo for triple-negative breast cancer, which means that breast cancer is not responding to progesterone or estrogen. However, omega-3 fatty acids, and this was published in the AACR annual meeting of 2013, April 9th. Omega-3 fatty acids worked against all, this is a quote, types of cancerous cells, but the effect was observed to be the strongest in triple-negative cell lines, reducing proliferation by as much as 90%. That's with no effective chemo out there. It says basically in this category, triple negative, not responsive to progesterone nor estrogen. We also noted that no targeted therapies are currently available for patients diagnosed with triple negative breast cancer. Omega-3 and its metabolites were observed to inhibit proliferation in all cell lines, but the effect was most dramatically pronounced in the triple negative cell lines. In addition, the metabolites of omega-3 reduce the motility or ability to move by 20 to 60% in the triple negative basal cell lines. Something to think about when all options appear to be off the table. There's one you can throw on the table. And it said that omega-3s, metabolites either from hemp, flax, fish, seem to be very potent. They seem to do better than the chemo drugs. It's something you can do on your own, maybe along lines with your oncologist if you find yourself in that type of situation. And now we talk about uterine fibroids. Guess what? Real easy solution, vitamin D. They found that women with the highest levels of vitamin D in the body had a 32% reduction, or I should say reduction, or lack of prevalence, or less likely to develop fibroids than women with insufficient vitamin D. In fact, they found out that obviously fibroids, the number one reason for hysterectomies in the United States. If you were outside in the sun for at least an hour a day, your chance of developing fibroids was reduced by 40%. Now, I don't know if that was with sunscreen or without sunscreen, but still, it would be wonderful if something as simple as inexpensive as getting some natural sunshine on their skin each day would help women reduce their chance of getting fibroids. Pretty amazing. Simple, basic, and cost-effective. And lastly but not least, before we're out of time, I think we have less than 1 minute left. All right. Adult generations today are less healthy than their counterparts of previous generations. Well, to do this as far as synopsis, let's put it this way. The 40-year-old of today is not the new middle age. The 40-year-old today is basically the new 55. We are 15 years ahead of aging and disease than our ancestors were 10 years ago. That means an average 40-year-old male today is as unhealthy as a 55-year-old was 10 years ago. My time is up, and thank you very much for this part.
Wow, thank you very much, Ralph. Once again, do your research. Join us for our shows. Thank you.